remember there was a lot of discussion back and forth.
There was just a cluster of cases and also a strange pneumonia.
On one hand, we saw our friends who were sick and dying, and we had these
prejudice against Haitians.
People shouldn't leave this world like that.
People were dying. Friends started dying.
Yes, I was one of those people that had this.
You have no idea what it was. People were literally dying like flies.
It was absurd. It was insane what we were confronted with.
Not knowing what it is probably more fearful than anything else.
It wasn't going to be if he was going to die. It was going to be when he was going to die.
We needed help. There was no one helping out. There was no one.
They didn't want to hear about it, and they didn't want to help. They didn't want to help.
August 11th, 1981, we had 80 people in this room to listen to Dr. Freeman Keene talk about what was happening.
It was staggering what people, in the finest hospitals in the city, people were laying in shit. Whole zip codes redlined by insurance. It was insane. Insane. So what we did was try to bring some order to it. We brought a lot of really good people and a great deal of compassion and some damn good systems that are still there.
And it was one of the first times that I can remember the gay community quickly got together and raised money and raised it quickly for a crisis that really didn't have a name and didn't really have a definition.
It was called Gay Men's Health Crisis. And this was an admirable group that immediately tried to help the patients and their families and their partners in life.
You get a client that would, you can have a couple months. I doubt my clients never lasted a year. And it was by the time you got to know them, they were gone.
You know, you couldn't just let yourself feel the full extent of what was happening. There was too much to do. There was too much responsibility. There were too many people to take care of.
It got to be like a combat. So many people I knew were sick and whole pockets of communities were wiped out.
Ten years ago was when we really turned a corner in HIV in terms of treatment. We identified potent drugs and began to use 3 drugs together, and we really saw dramatic changes. The last 10 years has really changed the face of HIV.
Sometimes people ask me, aren't things so much better now?
It's worse now than it ever was. I think the only difference is it's happening to poor people.
It's not the fashion of the moment. It's almost redisguised itself.
My daughter was positive, so and that's how I found out I was. And I was lost. I mean, I didn't know anything about anything. Gmhc helped me a lot. Helped me out so much. When I brought her in there, she knew that she wasn't alone. I'm sorry, my daughter passed, and I don't talk about her very much. Whew.
I just took the test, but not knowing it would come back positive because I was pregnant when I took the test. It was another place to go where I could talk about me with other women, and they also had child life too, so my son could come there too.
I decided to call Gmhc. I mean, my hands were shaking and I didn't really know what to do. I don't think I said much when I called. I think I said I need some help, and I think they understood what I meant. And that night, I also determined that I would never not fight, and I think that that's something that was instilled in me in those early conversations with Gmhc.
In general, people feel apathetic, and I don't want that for the next generation, and I definitely don't want that for my son.
We have to learn to help them all, and to continue at the same time educate the public.
I can get sick, that medication can stop working at some point. However, number one, I value much more my life.
We just need some people to come forward again, and I think we can wake up America.
Because I think of him and he stays with me, and I see him smiling down with his beautiful blue eyes, just watching us all as we're doing what he told me to do, which is to make sure that he wasn't a statistic.
We are fierce fighters for people living with HIV. We fiercely fight for poor people, for undocumented individuals, for disenfranchised, and that in some ways, that's where our history is.
People have always been allowed to suffer and die, and we've just learned it recently, most recently with AIDS. There's always some part of the population who is always going to be found dispensable to the majority, and if we've learned anything, it's that, which is why this work must continue and must always continue.